Assalamualaikum and good evening to Madam Zuhaira. My name is Muhammad Wakiuddin bin Muhammad Tajuddin, and today I will be presenting about the assignment 1B, which is a disease of the heart. So before I start my presentation or I share about my content, I would like to share about the introduction of the heart failure. So what is heart failure? Heart failure is the heart that unable to pump like a normal condition. It is usually happens to the old people, or the people have a weaker heart, and also the people have a heart with like a stiff. But heart failure doesn't mean that the heart is stop working, because when the heart is stop working, that person will lead to the death. So there are several types of the heart failure, such as left and right-sided heart failure, and also congestive heart failure. When we heard the congestive heart failure, it is similar to the heart failure, but the terms of the congestive didn't use widely to the people. Left-sided heart failure is causes of the systolic and diastolic failure. This failure can lead to the heart is unable to contract and also relax. Right-sided heart failure also related to the systolic and diastolic failure, but it is more to the left side, because left side is used to pump the blood to the whole part of the body. So for the right side of the heart failure, is the blood are unable to contract and also relax to the pulmonary area, and this is usually can cause a swelling to the abdomen and legs and ankles. Even though there are many different types of the heart failure, but it is also similar in terms of the etiology, sign and symptom, and how does this happen, and also pathophysiology. This will be discussed more in detail after this. If you have seen in my titles, I already put the diseases that I chose, which is a congestive heart disease, but I will relate it about this topic with such as systolic and diastolic failure, because it also plays major roles in the congestive heart failure. There is also misunderstanding about the heart failure and also heart attack, because the heart failure and also heart attack, when we heard, is sounds similar, but in terms of the symptom and when we heard the meaning is very different, because the heart failure is more to the causes like we see in the drama, like more people fell out because of heart attack. It is because of the blockage in the blood supply. But for the heart failure, the muscle of the we can see the muscle of the heart is become weaker time by time. So now let's moving on to the etiology of the congestive heart disease. So before that, I would like to telling about the meaning of the etiology, which is a study about the causes of the diseases. So there are several types of the congestive heart disease, such as a coronary artery disease, hypertension, severe lung disease, a family with a history of heart failure, smoking, and also lack of exercise. So the main causes of the heart failure is about coronary artery disease. The reason why the coronary artery is supply the oxygenated blood to the whole surface of the body, that able the heart taking the oxygen for the pumping system. When there is diseases in the coronary artery, there is like such as a blockage in the blood supply, the oxygen cannot reach into the heart, on the surface of the heart, which is the muscle or the tissue of the heart, cannot take the oxygen and also cannot be functioning. The reason why they cannot be functioning, because there is a cholesterol, which is a blockage inside of the arterial wall. When there is the blockage inside the arterial wall, the blood cannot be passed through to the whole part, like the surface part, like the left margin of the surface. For example, left margin of the surface, so the left side of the heart cannot able to pump to the whole part of the body. So this also related, such as a lack of exercise and also the obesity and also the family with a history of the disease. So now let's moving on to the sign and the symptom of for the congestive heart failure. So the main symptom of the heart failure is shortness of breath, like right now, or hard to breath, and also fatigue as the heart failure is become more severe days by days. There is also other signs of the congestive heart disease, such as a chest pain, frequently coughing, swelling at the abdomen part of the lower area, confusion, lack of appetite, tiredness, and also irregular heartbeat. So now let's move on to the mechanism of the disease, such as how does this disease happen and related with the pathophysiology. When the congestive heart failures occurs due to the systolic and diastolic is failed, like I mentioned, there is some relations between this disease. The meaning of systolic is contraction, while the diastolic is relaxation. When the heart having a systolic heart failure, the heart is unable to pump blood through the whole body. It is also same as a diastolic heart failure. The blood will not fill enough into the heart for the heart to pump the blood to the whole body and cause the congestion fluid build up because of blood in the lungs. I'm sorry. The systolic and diastolic heart failure can cause either in left or right side. But the left side, I will be talking more to the left side because it is usually systolic in the left side, because the left side is playing the role to pump the blood to the whole body. So there are also cases about the coronary artery also affected in the heart failure. The coronary artery are more on the surface of the left side, because the left side need more energy and also oxygen to this tissue to pump the blood to the whole body too. So when there is a clot inside the coronary arteries wall, the oxygen supply cannot pass through to the surface of the heart and can cause heart attack. This also can be damaging the myocardial tissue. The hypertension is also one of the causes, because of arterial pressure is increased. It will make the heart is hard to pump into the systemic circulation. So that is hard. So the meaning is the heart is have a difficulty to pump to the whole part of the body. The left ventricle also grow and enlarge, increase the pressure of the blood to the pump to the systemic circulation. And this is the left ventricle also I'm sorry, the left ventricle also grow and enlarge due to muscle because of the hypertrophy. This will increase the muscle and also increase the pressure of the blood to pump to the systemic circulation. When the heart is increased, this will increase the muscle and increase the pressure, and also the coronary arteries will be squeezed because when there is squeeze, because of the enlarge of the heart, it will make the blood supply of the heart is low. This also will lead into the fail of the contraction. Even though the systolic heart failure is mainly on the left side, diastolic failure also happens in the left side too. In the hypertension, it is same with the systolic heart failure, but the centromere will generate more in parallel in the myocardial tissue. Centromere is a muscle fiber for the main contractile and the function of it to contract the muscle. So when there are more generators of the centromere, the intraventricular space has less room because of the enlargement of the muscle heart. When less room in the chamber, the blood also low fill in the chamber. This will lead to the diastolic heart failure. So when the low amount of the blood volume, that also the low rate of the concentration of the oxygen level in the blood. So next will be moving on to the pulmonary area. Because of the systolic and diastolic failure, it will cause the blood to back out. The backout in the pulmonary vein and capillaries will increase the pressure in the pulmonary artery. This will make the blood, when pumping, need to pass through into the interstitial space that cause the pulmonary edema. When got the pulmonary edema, it will affect the gas exchanges in the alveoli. The reason why it is affected the gas exchanges in the alveoli, because there is a fluid inside of the alveoli that makes the gas exchanges need to takes time to pass through into the fluid, and also to enter and also to exit of the alveoli. So this will lead to the dyspnea and also eutropenia. So lastly, is the epidemiology of the world. For the world, I will be taking the United States of the America for the example for the epidemiology, because the America have the highest rate of heart failure in the world currently. In America, there are reportedly almost 6 million people that has been diagnosed of the heart failure. Every year there are new cases, about more than 870,000 people that diagnosed and suffer with the heart failure. Average all year for the people, America is hospitalization is about above 50 to 60 years old. However, this number did not improve the quality life and number of hospitalization. According to the Global Health Data Exchange, there are 64.34 million cases, that many, that are suffering of congestive heart failure in the current worldwide right now. So this registry data is about cases, also have specifically about the races that have a congestive heart disease too. 25% of the higher prevalence of the heart failure is patient more to the African American native. Other than that, there is the Hispanic American, Native Americans, and recent immigrants also have a highest incident prevalence of the heart failure. Now we have reached at the end of the presentation. For my conclusion, no matter what such as diseases like diabetes or another, we must be avoiding at any diseases, not only in the heart but also all the organs that we need to take care. So that is for me. Thank you. So this is my reference that I have done for my presentation and also my report. So thank you very much for the listening, and also I am sorry for my mistaken for the grammar and also for my English pronunciation. So thank you very much.